Welcome to Chamber Exchange, a TV show. My name is Tim Murray, President CEO of the Worcester Regional Chamber of Commerce. And Chamber Exchange, a TV show, is an opportunity for us to bring on our chamber member guests and organizations to talk about the work that they're doing out in the community in central Massachusetts. I want to thank our sponsors who helped make the show happen, St. Vincent Hospital and Bank Hometown. And here in our first segment, I want to welcome Dr. Laurie Bonavita and Jasmine White from Autism Allies. Welcome.
Welcome. Thank you. Thank you so much for having us again.
Yeah. So I know it's our second, time, but for those who maybe missed our first segment, maybe you could just share a little bit about what Autism Allies is all about.
So we are insurance-funded, home and clinic-based ABA service, applied behavior analysis, that provides therapy and treatment to individuals diagnosed with autism.
And you mentioned insurance-based, so maybe you could elaborate in terms of as people have health insurance, they're eligible for
Absolutely.
services.
Most insurances will pay for the service. So sometimes families will have a copay, but generally insurance picks that up. And so it's like going to a doctor or a dentist. The kids receive service and the insurance pays for it.
And like so many other medical issues or conditions, a lot of it is diagnosis and treatment early and intervention and engagement. So how does that process, and sometimes that starts when a youngster starts school, sometimes family or medical professionals can kind of give a diagnosis of autism. What is kind of that process and integration working with a provider and or schools?
So if a family member or school personnel suspects an individual of possibly having the diagnosis, they'll refer them usually through their pediatrician to a child psychologist or a neuropsychologist who will then perform a series of assessments and then give the diagnosis. At that point, the diagnostician will then refer to a company like ours who will then provide ABA service.
Mm-hmm. Jasmine, your role with Autism Allies?
So I am the Director of Clinical Service for the Worcester branch. I help oversee the day-to-day operations and help guide my clinicians to best support our patients in our Worcester clinic and oversee the day-to-day operations there.
Right. And so if we're talking about young students who may be in school, so these would be services or programs that would be able to augment maybe what is going on at school beyond that?
Yeah, so we actually offer a school readiness based program where we're preparing these young children for those transitions to school, getting them ready to be in a different environment, a more social environment, and giving them the communication skills and the social skills that they need to be successful when they do have that transition. Right,
so I assume that's involving some level of coordination with a IEP, Individualized Education Plan, or 504, and working with the family and providers both in your setting and in a school setting.
Yeah, so we are able to attend the IEP meetings and provide that additional support to the family and work alongside school practitioners to have a multidisciplinary team where we're all working holistically to support our patients.
Right. And, school, generally speaking, is 185 days a year, but, oftentimes maybe some of the supports or services are year-round.
So we offer a summer program for kiddos that are enrolled in school during the school year, and it usually runs about 9 weeks, and they're theme-based, still steeped in the principles of applied behavior analysis and delivering that service, but in a different and kind of fun and inclusive way.
Mm-hmm. And the age groups, the ages that your Autism Allies kind of works with?
So we'll do, probably our youngest patient that we've ever had is about 15 months, and then we'll go all the way up to 22. Right now we're about, I'd say the bulk of our clients are in the 8-9 year old range, but we have full day programs, after school programs.
Right. And Jasmine, you had mentioned kind of Worcester, Central Mass. If I remember correctly, kind of Central Mass and Western Mass is kind of the footprint.
Yeah, so our flagship clinic is in Shrewsbury,
okay.
And then we have Jasmine's clinic in Worcester. We have one in Agawam in Western Mass, and we're opening 2 more clinics as we turn 10
Oh,
this
really?
year.
Okay.
Yep.
Is that just like the teaser? You're not going to tell us where and when?
One will be in the Western Mass area, and we are actually moving into Connecticut.
Okay. There you go, the Pioneer Valley.
Yeah,
moving down.
exactly.
So, Jasmine, in your role as the director, staff size, location, facility, maybe share a little bit about that.
Yeah, so we're actually in a pretty cool and interesting area where we're in the historical district of Worcester, so it provides a unique opportunity to kind of get away from that typical medical clinic-based setting that you typically think of when you think of ABA. We currently have the capacity to service between 20 to 25 patients, which is amazing.
Mm-hmm.
And we have an amazing team for BCBAs that 2 have started already and 2 are coming on later this summer. And they bring a really strong, diverse background of experience, so I'm excited.
Yeah, and a BCBA is?
Board Certified Behavior Analyst.
And maybe just some of the educational background that someone in your fields, kind of, I'm sure there's different levels, but like a baseline provider would be, what would their educational background be?
So they would be a master's level clinician. To obtain your BCBA certification, you go through a series of field work and coursework through an accredited university, and you're able to then sit and test with our board and get your certifications to practice.
And the test is hard.
Yeah,
It's very difficult.
And so kind of a BCBAs, then doctors, et cetera, kind of.
So I'm lucky to have consulting with me Dr. Dan Almeida, who is from Cambridge College, and he consults with us on our training programs to ensure that our behavior technicians coming in know what they need to know to deliver excellent service to our kiddos. When we have a behavior technician come in, they can take a 40-hour course that it will make them a registered behavior technician, so they can earn that credential, and we supply all that training for free. So we really want to make sure that the people who are interacting with these children and providing the therapy have the best training possible, so it's excellence in service delivery all day, every day.
And would that technician kind of be that an entry-level position into the field, and then BCBA, and then upwards?
Yes, yes. And we're creating growth positions for our behavior technicians as well, because a lot of people don't want to go to a master's program, so they're quite happy where they are. So we want to be able to recognize when we see leadership, qualities in someone. So, and they will provide some training to our behavior technicians coming in. So it's I think it's a great little family system.
Right.
And we promote, internal growth that way as well.
And the total number of employees in all your locations?
So we have about 85, depending on
Right.
the day. 80 to 100 is kind of where we fit, although with the 2 clinics opening, that number will jump quite a bit, but and we service about 120 patients right now.
And is there, I assume, levels, there's various levels of autism, and does that kind of dictate the frequency and the programming?
Absolutely. So on the initial intake, the BCBA will go out into the home and do 2 observations and speak with the parents, because that family component is very important. And then we'll kind of decide together with the family how many hours fits with their lifestyle and how many hours we, recommend clinically, what we see as clinically appropriate, and we'll submit that to insurance for approval.
Right. And just Worcester Public Schools, but just generally our public schools across the board, increasingly diverse, language issues, making sure there's cultural competencies that people are aware, parents are aware early on about some of the signs or symptoms and how important early intervention is. How do you kind of get involved with that and getting the word out?
Do you want to take that? Okay. So we have we have Spanish-speaking clinicians, and we hire translators to make sure that families are understanding what the science is and what their rights and the opportunities are under insurance. When we say one of our missions is to serve the underserved, so we're constantly looking for kind of non-clinical events to attend just to be part of the community, so people understand that, oh, if I think my kid has autism, I can go to this company right here. We have a great admissions manager who, if someone calls in and said, this is what's happening and please help me, and she has a list of resources to hand families as well. So we don't currently diagnose, but we are looking to add a diagnostician to our team. So.
Gotcha. Anything you want to add to that, Jasmine?
No, we're pretty much, covered that basis.
Yeah, if someone's looking to get in touch and learn more, is there a website or place that they can go?
Yes, they can visit autismallies.com. We also attend several different ABA conferences throughout the year, and there's multiple ways to get in contact with us, and we're always available to reach out and consult with the family to see what the best option is for their child.
Got it. autismallies.com.
These days, you've got your hands full in life. That's why we help you bank simply and securely with tools like Face ID and Touch ID. It's why we make it easy to make purchases on the go and get cash back while you're at it. Why we help you quickly deposit checks wherever you are. And it's why we lend a hand with sending and receiving money right from your phone. So even when you're on the move, you can manage your finances. Bank Hometown. Unlock your potential.